Welcome to Ararat Healthcare and Charkos Learning Centre, your one-stop solution for IELTS, OET, CBT and OSCE training, as well as recruitment to achieve your dream to be a registered nurse in the UK. To enhance your chances of passing your OSCE on the first attempt, please visit our website on www.charkoslearningcentre.com to register and book our unique OSCE portal consisting of videos, reading material and quizzes. This registration not only gives you access to the portal, you will also receive 5 complimentary online classroom-style sessions and a mock OSCE test. So don't delay your achieving your dreams any longer and sign up now. So, capillary blood glucose sampling. To undertake the blood sugar measurement is a simple procedure in itself, but you need to make sure that you are doing that safely and giving the correct patient information. So you will need to know, if you don't know already, in the UK the blood sugar measurements are done millimoles per litre. So you need to know that 4.5 to 7 is the normal range for blood sugars. So if you're used to working in milligrams per decilitre, make sure you are familiar with millimoles so that you can work out whether this is a normal level, high or low blood sugar that you're giving, so you can give the right advice to your patient. Entering the room, checking for the scene safety, making sure it's safe to approach my patient and doing my hand hygiene before I approach. Good morning.
Good morning.
My name's Julie. I'm one of the nurses looking after you today. Just for my clarification, can I double check your name please?
Yeah, my name is Ali King.
And your date of birth?
It's 1st of January 1969.
Okay, can I double check that with your wristband please?
Okay.
So, Ali King, and you said your date of birth was the 1st of the 1st, 1969, and I can see your hospital number here is 0004321. Lovely, that all matches with my paperwork. What would you like me to call you?
You can call me Ali.
Ali. Okay, lovely. I've come here to test your blood sugar level at the moment before you have your lunch. Is that okay?
Yeah, that should be fine.
Have you had this test done before?
Oh, yes, I have.
Okay, so I'm just going to go and grab the equipment. Whilst I'm away, do you mind washing your hands with some warm soap and water and making sure they're dry thoroughly? Is that okay?
Okay, that should be fine.
You're mobile enough to do that?
Yes.
Okay, lovely. I'll be right back with your testing kit then.
Okay.
I'm going to do my hand hygiene. I'm not washing my hands at this time. My hands are physically clean. If they weren't, I would use soap and water to clean them. Okay. And one pair of gloves. Okay, so I have on a clean apron and gloves, and I'm going to clean my equipment ready for use. So I have a packet of universal wipes, which are 7% alcohol, and just checking the expiry date and end date. So I'm going to take a wipe, and I am going to clean my tray before I use it. Okay, so cleaning inside the tray, zigzag mirror, and on the outside, dispose of it in the chemical waste. Okay, so I am going to take a sharps box, making sure that it's all completed and not over full in there. Okay, I'm going to dispose of these gloves and apron. And with my hand hygiene. So for this, I am going to need a glucometer, and I have already checked that it's calibrated and safe to use. So I have my glucometer and I have my test strips. I'm going to double check the expiry date on those, and they are safe to use. I am going to need a single-use lancet, which will be disposed of in the Charkos box. I will need some gauze for wiping the end of the finger, and this is our blood sample that we haven't yet got, and we are going to get from our patient's finger. So I'm going to need one clean pair of gloves, and I'm ready to go back to my patient's bedside. Okay, just entering the room, checking for safety one more time, doing my hand hygiene. Hi Ali, I'm back.
Hello.
Did you manage to wash your hand okay?
Yes.
Okay, lovely. Do you have any preference on which finger we would like to use?
No, but it would be good if you can use my left hand, please.
Okay. Do you normally do this yourself?
I have done it.
Okay. So you can watch, make sure I'm doing it correctly, okay?
Sure.
Okay, so I'm popping on a pair of gloves before I start. So I'm sure you've found by now that if you do your thumb or your index finger, because we use those fingers the most, it tends to get sore. So we advise not to use your thumb or your index finger, but we would use the two middle fingers predominantly, okay?
Okay.
So you may well use a pen with lancets at home, but in the hospital here we are going to use a single-use one, okay? I'm just going to get my test strip out ready. This one, these are very fiddly, especially when you've got gloves on. Just one of those. I've already checked the expiry date and everything is okay. So I'm going to place that in here, and I'm going to just use one of these gauzes just to make sure the tip of your finger, I'm going to use this finger, is that okay?
Okay.
Is dry, and twist, oh, it went off. Twist in the end here, and I'm going to prick your finger. Okay, and just give it a moment. There we go, let's line that up there, and that's sucked up the blood that it needs, and it's working. So let's wipe your finger, making sure you've stopped bleeding. And lovely. And here we have a result of 5.2 millimoles. So Ali, your blood sugar at the moment is 5.2 millimoles, which is great. That's perfectly within the normal range. I'm just posing of that and my lancet into the Charkos box there. Okay, I'm going to take my gloves off and do my hand hygiene. And that's it. I was going to get you something to eat, whatever it is that you ordered. Okay.
Okay.
And I'm leaving you with your call bell if you need anything at all. And I just press that. Opening absolutely not blocked off from the world.
Okay.
I'll see you soon, Ali.
Thank you.